Factors affecting bioavailability are as follows. Physical properties of drug. It includes pKa, partition coefficient and particle size. Pharmaceutical factors. It includes dosage form and formulation variables and dissolution rate. Physiological factors. It includes effect of gastrointestinal fluids, gastrointestinal transit time, first pass effect, absorbing surface and diseased state. pKa. The pKa value indicates the strength of an acid. The extent of ionization depends on pKa of drug and pH of the solution. At a pH equal to the pKa value, 50% of the drug is ionized. Ionized form of drug is not readily absorbed. Unionized form of drug is readily absorbed. Acidic drugs with pKa values between 3 to 7 remain unionized in the gastric fluid, thus they are well absorbed from the stomach. Partition coefficient. It is the ratio of the solubility of drug in a non-aqueous solvent to an aqueous solvent. Higher the value of partition coefficient, the drug is more lipophilic. Non-ionized form of drug is more lipophilic as compared to an ionized form of drug. As biological membrane is lipoidal in nature, drug with higher partition coefficient values are more absorbed through lipid membrane. Particle size. A decrease in particle size of a drug increases surface area. An increase in surface area increases the dissolution rate and subsequently increases the bioavailability of drug. A classical example is griseofulvin. Reducing the particle size of griseofulvin increases bioavailability. Dosage form and formulation variables. The drug administered in the form of an aqueous solution is absorbed more rapidly as compared to an oily solution or solid dosage form such as tablets or capsules. However, currently various novel drug delivery systems are available with enhanced drug dissolution rate and bioavailability. Solutions. Solutions are absorbed most rapidly from the GI tract. Aqueous solutions are absorbed faster than non-aqueous solutions. As the viscosity of the solution increases, the absorption rate decreases. Non-absorbable complex formation with other components also decreases bioavailability. Suspensions. In suspension, particle dissolution is required before absorption. An increase in the particle size decreases bioavailability. Rate of absorption and thus bioavailability decreases with an increase in the viscosity. The formation of a non-absorbable complex with other components decreases bioavailability. As the crystalline form is less soluble than amorphous form, the bioavailability of amorphous form is high as compared to crystalline form. Capsule. Interaction with a diluent such as adsorption or complexation may affect the bioavailability of a drug. As for example, diluent calcium phosphate forms an insoluble complex with tetracycline, thus reducing its bioavailability of tetracycline. Complete wetting in biological fluid is required that can be achieved by the use of surfactant. Bioavailability decreases with an increase in particle size. As discussed earlier, crystalline forms are less bioavailable than amorphous form. Tablets. Tablets need to be disintegrated into the granules and thereafter into fine particles. Disintegration of tablets into fine particles depend on the concentration of binder, disintegrant, lubricant, compression force etc. High amount of hydrophobic lubricant prevents dissolution and subsequent bioavailability. Increase in compression force increases hardness, increases disintegration time, decreases dissolution rate and decreases bioavailability. Dissolution rate. Dissolution rate is the rate-limiting step in the bioavailability of the poorly water-soluble drugs. Dissolution rate is determined by Noyes-and-Whitney equation. An increase in dissolution rate increases bioavailability of number of drugs. Effect of gastrointestinal tract fluid. Mucin forms a thin layer over the epithelium of gastrointestinal tract from complexes with various drugs and reduce bioavailability. The activity of aluminum antacids is reduced by various proteinaceous materials. Dissolution rate of poorly water-soluble drug is increased by bile salts. Many drugs such as nistidine, amphotericin B and chloroquinol are inactivated by bile salt. Most proton pump inhibitors such as omeprazole are degraded at acidic pH of stomach. Gastrointestinal transit time. Movement of drug in the gastrointestinal tract depends on motility of stomach. Absorption of aspirin is reduced by delayed gastric emptying. Food prolongs gastric emptying time and affects the bioavailability of a number of drugs. Food reduces the absorption of amoxicillin, penicillin and cephalexin. Food increases the residence time of acid-labeled adenosine in a low pH of the stomach. This decreases bioavailability of didanosine. First pass effect. Orally administered drugs are first presented to the liver via the hepatic portal system. If the drug is rapidly metabolized in the liver, only a small fraction will reach the systemic circulation. This phenomenon is called as first-pass effect and may significantly reduce bioavailability. First-pass effect is not observed for sublingual, buccal, parenteral, inhalational aerosol, vaginal and transdermal. Absorbing surface. Skin is a poor absorbing surface as compared to the GI tract. Absorption from the sublingual route is faster. From the highly vascular membranes, absorption of drug will be rapid. Because of large surface area of intestine, drug would be absorbed more as compared to stomach. Diseased state. The bioavailability of a drug in patients can differ from that in healthy normal subjects. The bioavailability of drugs eliminated primarily through the kidney is expected to increase in patients with impaired renal function. Bioavailability of the drugs that are metabolized by liver increases in liver dysfunction. Conduction of pharmacokinetic studies is required in such patients for the dosage adjustment, so that the bioavailability of drugs match with normal patients.
Thanks for watching. Subscribe for more videos.